Hi, I'm Dr. Hemalata Arora. You're listening to me on Sify Doc.
Reasons that make infectious and lifestyle diseases so important.
While infectious diseases and lifestyle diseases may affect different sets of the population, the important thing to remember is that both of these typically will affect the very productive young people, of course also old people, but very much the young people, and that is the major productivity of the country it will be lost because of the amount of this disease burden. Therefore, it is very important to prevent both infectious as well as lifestyle diseases, and also both sets of diseases are very easily preventable by both individual and collective action.
Share your expert guidelines to keep infectious and lifestyle diseases at bay.
While infectious diseases and lifestyle diseases affect similar populations, I would have to say that the measures that are required to keep them at bay are slightly different. To keep away infectious diseases, one needs to have very high levels of sanitation, awareness of what are the infectious diseases that are prevalent in the community and in the country, and ability to seek health care as soon as possible when one is suspected. The lifestyle diseases, on the other hand, are more of an everyday discipline regarding food, minimization of stress, sleep, physical activity. Of all of the above, I would think that physical activity would remain the most important. 30 to 45 minutes of walking every day can cure many illnesses.
What precautions are required to keep away swine flu and how is it treated?
Swine flu, just like other kinds of influenza, is a viral infection and is a respiratory viral infection caused by droplet method of transmission. Droplet infection means that whenever there is a cough or any respiratory fluids are transmitted, these are the way the virus is transmitted from one person to another. Now, whenever a person coughs, about 3 feet to 4 feet around the person is how far the virus can be transmitted. It is important to stay, first of all, away from people who are coughing. The persons who are coughing should be always covering their cough. If you have a cough, you should cover your cough, and always wash your hands immediately before and after coughing, as well as before touching your own face. Encourage other people who are coughing to seek medical care immediately. If you do have swine flu and you're diagnosed with swine flu, it would be important to stay at home and avoid public places to avoid the spread of infection. The treatment of swine flu is, there is a medication available called oseltamivir or Tamiflu, which is an antiviral medication, and a short course of this will treat the swine flu virus. However, the important thing to remember for the swine flu virus is that the virus itself doesn't cause as much harm as it lowers the immunity, and a secondary bacterial infection can set in, which really is dangerous. So, it is important to look out for signs of a secondary bacterial infection setting in, which could usually be that the flu gets a little bit better and then starts to get worse, or later in the course of the illness one gets more breathlessness, chest pain, fever, etc. If any of these happens, urgent medical attention must be sought.